Bariatric surgery is the most effective method of weight loss. However, bariatric surgery is complex and there are some associated complications. During a traditional sleeve gastrectomy, approximately 70 to 80% of the stomach is resected. During the endoscopic sleeve gastroplasty procedure, also known as the ESG, we have tried to emulate the traditional surgical sleeve in a more minimally invasive fashion. Using a special endoscopic suturing device that is attached to the end of an endoscope, we have attempted to reduce the volume of the stomach by approximately 70%. This animation depicts the endoscopic sleeve gastroplasty procedure. The endoscope is inserted through the mouth into the stomach. The aim of this procedure is to reduce the volume of the stomach by approximately 70%, similar to a surgical sleeve gastrectomy. The front and back walls of the stomach are marked to help guide placement of the sutures. Then, the endoscopic suturing system is attached to the endoscope and used to take full-thickness bites through the wall of the stomach. We perform a running suture pattern that connects the front and back walls of the stomach. Then, the sutures are tightened, bringing the walls together. This pattern is repeated along the stomach to not only reduce the volume, but also the length of the stomach. The beauty of this procedure is that it is performed endoscopically and thus there are no scars. The procedure is minimally invasive and because of that, it can be done as an outpatient procedure with no overnight stay. The procedure takes approximately 90 to 120 minutes and patients recover in 1 to 3 days. The endoscopic sleeve gastroplasty procedure is ideal for patients who have been unable to lose weight with diet and lifestyle modification therapy or medications. It is also an alternative for patients who do not meet the traditional criteria for bariatric surgical procedures. Patients who are seeking an alternative or a minimally invasive procedure can also have an endoscopic sleeve gastroplasty. We can also perform an endoscopic sleeve gastroplasty on a patient who has previously had a laparoscopic sleeve gastrectomy procedure and regained weight. You can expect to see anywhere between 16 to 23% of total body weight loss with an endoscopic sleeve gastroplasty procedure. However, more importantly, studies have demonstrated an improvement in obesity-associated metabolic disease, such as diabetes, hypertension, and fatty liver disease.